Typically, you're going to come in for an initial consultation where you'll get to meet me, get to meet all of our office staff. We're going to go through the surgery in detail. We're going to try on some different size implants. Then the next time I typically am going to see you is at the pre-op visit. So that pre-op visit is usually just a couple weeks before the surgery. At that visit, we're going to confirm that we're all on the same page. We decided the implants that we're going to use and just kind of confirmed up and finalized the details. So breast augmentation surgery is a simple type of procedure. You're going to show up about an hour before your surgery is scheduled. They'll kind of get you checked in, make sure you're comfortable, go over medications and other types of things like that. And we'll take you back to surgery. At that point, you'll get really comfy, you'll go to sleep, and then we're going to perform the surgery. The surgery does involve an incision, just usually a small, about 4.5 to 5 centimeter incision just along the lower part of your breast. I'm going to put an implant in either underneath your muscle or above your muscle, and then I'm just going to close it up and put you in a wrap. And then typically you're going to go home within about an hour. I'm going to call you that night and make sure you're doing okay, and then you're going to come in the next day for a follow-up appointment, which is just going to be a real quick check. Just make sure things are doing okay, you're not having any problems. One other really cool thing that I use, and I think I'm the only one that uses it in the Valley, is something called a Keller funnel. And what it looks like is literally just a funnel. It's this funnel that you can imagine you would use it to bake a cake, but what I do is I'm going to put my implant or your implant inside this funnel, and I'm going to use that funnel to insert the implant underneath your muscle. And what it allows is it allows your incision to be a little bit smaller than an incision that I'd have to push the implant through if I didn't have this funnel. So as far as a style for breast augmentation, I would say that most commonly I'm doing a natural approach to breast augmentation. I use different types of implants. I use round implants, I use the teardrop or the shaped implants, or some people like to call them gummy bear style implants. And what I try to do is I try to talk to the patient and try to figure out what is the result that they're trying to achieve. Some patients are going to want a rounder, more full look up top. Some patients are going to want a really natural look. They don't want a lot of fullness up top. And so my job is to figure out what they're trying to achieve and then deliver those expectations and achieve those results for them. For breast augmentation surgery, the quote for that is about $6,700. And what that is going to include is it's going to include your implants, it's going to include your initial consultation, it's going to include your pre-op visit, your post-op visit. It's also going to include the anesthesiologist who is in the surgery. He's the one giving you your anesthesia. He's monitoring you during the surgery while I'm performing the surgery. If you want to schedule an appointment at Elizabeth Institute, you can just give us a call, or you can come on by and set up a time to come in and talk with us, and I can give you, or we can give you more information on the different procedures that we do here.